Hi. Thank you so much for being patient. I know it was a little bit of a wait today. We're kind of double booked. But don't worry, okay? We have plenty of time. My name is Dr. Cozy. I am a neuro-ophthalmologist, and I see that we have you referred here to us because you've been experiencing some double vision, correct? Okay. About when did this start? Okay. Okay. Is the double vision horizontal? Is it vertical? Are you seeing two separate images? Do they overlap? Okay. If you close one eye, do you still see double? Okay. And any headache or any eye strain? Okay. Is the headache in one specific area? Does it move? Okay. So on the left, all right. How about any ocular migraines or any auras? Sometimes. Okay. About how frequently? Okay. Any other changes in your vision, like floaters, blurriness, any kind of streaking? Okay. And do you wear glasses or contacts? Okay, so your glasses are making the double vision worse. All right. Just looking at your notes here. Okay. Did your neurologist or primary care physician do any imaging? X-ray? Okay. They didn't include that, but I'll have our records department call and see if we can get those films. Okay. I just want to make sure because especially if we end up ordering any kind of imaging, it's nice to have something to compare it with. Okay. I would like to start by palpating around your eyes, just to rule out any kind of swelling or irritation. Is it okay with you if I touch you? Thank you. If there are any areas that cause discomfort or feel tender, let me know, alright? Okay. And actually, can I have you start, please, by closing your eyes? Thanks. to check the alignment of your eyes, okay? So just stare off directly into space. I'm gonna move your head just a little. Okay. Your eyes have good alignment. I don't see anything like one eye looking off to the side or inward that might be causing any kind of physical contribution to, or I should say external contribution to your double vision. Okay. So, I have my vision chart right here. Are you able to see it all right? Okay. So just using both eyes, can you read whichever line is the easiest for you to see? Okay. I'm going to place my occluder over one side. And just like that. Okay. Can you read that line again? How about the one under it? Okay. Now I'm going to switch eyes. Yep. Good. And, sorry, the one underneath it. Okay. I'm going to switch to a different side, right? So, does this improve things or make it worse? Okay. sorry. I'd like you to focus right here, right in between my eyebrows, okay? Okay. Follow my light. Don't move your head, just your eyes. Look at my nose. Look at my light. Okay. Nose. Light. My nose. The light. Look at my nose. Look at my light. Okay. Follow my light again. Look at my nose. Look at my light. Nose. Light. And follow my light. Okay. Continue directing your gaze forward. I'm just going to look at your eyes from the side. Continue gazing straight ahead. Okay. I'm gonna turn your head just ever so slightly this way. Might be seeing a tiny bit of swelling. But I'll need to take a closer look in just a moment using a more powerful kind of lamp. But right now, I want to measure the pressure in your eyes, okay? So let me just check really quickly. Okay, so this says you don't have any food or medication allergies, that's correct? Okay, I just wanted to make sure before we administer anything. I like to provide my patients with numbing drops to make this a bit more comfortable for you. So, stand up and tilt your head back a little bit, okay? So, far? Alright. Good. Okay. And again, tilt you back down. Okay. Those are just going to take a moment to kick in. Okay. So this is going to rest against your forehead just like so, okay? And I need you to just do your best to look straight ahead. Okay. I'm going to have you blink. Good. And now open and keep your eyes open. All right. Again, this is going to rest, right on your forehead. Let's have you blink. Good. And then hold your eye open for me. All right. Good job. So that's a normal range. Okay. So I'm going to draw you a little diagram here, okay? So these are your eyeballs, okay? So coming from your eyebrow, or eyeballs, sorry, not eyebrows, are these nerves. And these are your optic nerves, okay? And down here, where they meet, is the optic chiasm, which is responsible for interpreting visual information, especially between left and right eyes, and communicating it to your brain. So where I'm seeing, sorry, put this down early. Where I'm seeing the inflammation is along these lines, which I can see through your pupils. And it's making me suspect that there may also be some swelling here. But we won't know for sure, or we won't be able to see the whole picture without some kind of imaging. So I will be ordering an MRI with and without contrast. But in the meantime, I want to take a look with my lamp here and make sure that there's no other issue occurring within your eyes. Okay? Okay. It is a bit of a bright light, so it might be a little bit uncomfortable at times, but I'm going to do my best to make it as comfortable for you as possible. Okay? Okay. So I just want you to place your head so your forehead is flush with this bar. Your chin is on the chin rest here. Perfect. Okay. So, alright. Just need you to stare directly ahead for me. whites of your eyes. Looks good. Now do your best to keep your eyes open. pull your head back. Alright. So I did see that you have a few dry spots on your corneas, okay? Which is probably what's contributing to the streaking that you're seeing, as well as the double vision. But that being said, I did see some swelling, some papilloedema when I was looking inside of your eyes, and that was verified in here, so I do want to get some imaging. We'll be doing an MRI of your brain with and without contrast, because from this area beyond, even though the anatomy it's connected to your eyes, we do consider that part of the brain. So I want to see the extent of where that inflammation is going and how much inflammation is there. Depending on what we find, I will be needing to coordinate with your neurologist, and we may need to do a lumbar puncture to measure the spinal fluid pressure, but we're not there yet. So let's start with imaging. Before we write up that order, I'll just take off my gloves. I want to do a quick visual field test with you. So what that's going to look like is I have my Penlight here, okay? And I want you to raise your hand for me when you see my light. So don't move your head at all. I forgot to add that. Good. I'm sorry. That was premature. Can you repeat that with a different kind of light, okay? Sorry, I know I'm just like giving you some intense eye contact here, but it's important that if your eyes do anything concerning that, I don't miss it. Okay, good job. Did any of that cause you any kind of strain? Okay. And was the warmer or the cooler tone light easier to see? Okay. No, you're not meant to get all of them, don't worry. last thing I'd like to do is test your peripheral vision, okay? So I'd like you to direct your gaze right in between my eyebrows and tell me how many fingers you see me holding up, okay? Okay. Good. Good. Okay. Alright, so I'm gonna rate you in order for some imaging. And they may even be able to get it done today if you have time. Okay. Well, our front desk can help you schedule, don't worry, okay? So okay. So I'm gonna get these orders sent in, and then I also want to prescribe you some eye drops. It's called Zedra, and what it's going to do is help and reformulate your tears so that you produce higher quality tears that do a better job of hydrating your eyes. One thing about it is that it can cause kind of a bitter taste in your mouth as it drips down, so I use it too, and I always make sure I have gum in my mouth whenever I administer it. And it can also make your eyes, especially the inner corners where your lacrimal ducts are, feel pretty itchy. So another thing that we find that can help with that is to take just a normal like hydrating drop like Oasis Tears, Sustain, Refresh. Put a drop of that in each of your eyes first, and then add a drop of Zedra in each eye, and that can kind of help and reduce some of that itching. It's not going to get rid of it completely, but it'll make it a bit more comfortable. That being said, any hydrating drops you use, especially the Sustain, you're going to want to make sure on the label it says PF next to it, because preservatives in the eye are not ideal. Those can actually damage your eye. So always make sure that you're selecting the preservative-free. And one more thing about that is when you use a gel drop, like Sustain comes in a gel, or Oasis Tears, with the Zedra it can make your vision a bit blurry for a little while, so you'll want to make sure that you're not needing to drive or anything immediately after administering those. So I'm going to send in a prescription for that. The hydrating drops like Sustain, Oasis Tears, those you can find at a drugstore or on Amazon. They're over the counter. Yeah. Actually, with the Sustain, you might have a better time finding it on Amazon. That one I've had a hard time finding in stores for some reason. And then another thing that's really helpful is to make sure that you use something like fish oil, which can also help and keep your eyes hydrated. You just want to have some reasonable expectations. It's not going to be a quick fix. For most of my patients, for the Zedra to start making a noticeable difference, it takes about 4 to 6 weeks, give or take, of using them consistently morning and night. Unfortunately, there is not a quicker solution, and sometimes that doesn't even do the trick, I hate to say. But if you don't find yourself having a noticeable improvement within a month, come back and we'll figure out a different medication for you to use, okay? Okay. So, just a sec. Okay. So the CVS is your current pharmacy? Alright, we'll get that sent over. Okay, so I'm going to start out giving you just one refill just in case this medication isn't it. So I will check in with you in a month if I haven't heard from you sooner, and we'll see how you're doing, and if you are having success with the Zedra, then we will provide you with more refills, okay? Okay. Do you have any questions for me? Alright. I'm going to go pass your MRI orders off to our scheduling desk, and I'll get that prescription called in for you. Okay. It was really nice to meet you, and we'll talk really soon.